Hello friends, welcome to my new video, and this video is related to Aetcom module 1.2. What does it mean to be a patient? And the question is demonstrate the empathy in patient encounters. So let us start. So what is the empathy? Empathy is defined as the ability to understand and share the feelings of another. And it is the capacity to put oneself in another's shoes and feel what that person is going through and share their emotions and feelings. It is the recognition and validation of a patient's fear, anxiety, pain, and worry. So how do you demonstrate empathy to patients? So here is an example of how to show empathy to patients or not. So expressing empathy, lacking empathy. So start the appointment by making eye contact. So what is meaning of empathy? So E means eye contact. Then let your patient know you are listening and be aware of your body language. Be curious about your patient's condition. What is their problems? And record the details that humanize your patient and show the support to your patients. So in short, empathy, E means eye contact, M muscles of your facial expression. P means posture, A affect, T tone of voice, H hearing the whole patient, and Y means your response. So what does it mean to advance humanism in healthcare? So according to Arnold P. Gold Foundation, advancing humanism in healthcare is characterized as respectful and compassionate relationship between physicians and members of healthcare team and their patients. So recent article published in January 26th, 2019 in Modern Healthcare talks about the importance of having all the members of the healthcare team constantly educated regarding how to utilize patients' communication best practices to ensure the best outcomes. This title says it all. Physician empathy, a key driver of patient satisfaction. And this article was published by Science Daily and points out that 65% of the patient satisfaction was attributed to physician empathy. Additional Gold Foundation studies have also recognized the impact empathy has on improving health outcomes and its significance in patient care. So, what is the empathy? So, empathy that is defined as ability to understand and share the feelings of another. And it is the capacity to put oneself in another's shoes and feel what that person is going through and share their emotions and feelings. It is the recognition and validation of patients' fear, anxiety, pain, and worry. And it is the ability to understand patients' feeling and facilitate a more accurate diagnosis and more caring treatment. Expressing patient empathy indeed advances humanism in healthcare. As a matter of the fact, expressing empathy in healthcare is the key ingredient to enhancing the patient experience and patient encounter. Both empathy and compassion in healthcare that plays a vital roles in patient experience and are key components of the physician-patient relationship. When a patient arrives to see their healthcare provider, the patient's medical condition, whether it is severe illness or injury, or a chronic condition, or simply a routine checkup, will often manifest emotions such as anxiety, fear, and apprehensions. Patients want to know they are receiving the very best care, and that is conveyed when their care team is empathetic and compassionate. So, example of having empathy for someone. So, you may have noticed this when you cried watching a very sad scene in a movie. That is a cognitive empathy involving a thinking more than feeling. Cognitive empathy means putting yourself in someone else's shoes. When you see someone in need and offer that person some food or money, that is a compassionate empathy. Why the empathy important? So empathy that extends far beyond patient's medical history, signs and symptoms. It is more than a clinical diagnosis and treatment. Empathy encompasses a connection and an understanding that includes the mind, body and soul. So expressing empathy is a highly effective and powerful which builds the patient trust, calms the anxiety and improves health outcomes. Research has shown empathy and compassion to be associated with a better adherence to medication and decreased malpractice cases and fewer mistakes and increased patient satisfaction. Expressing empathy one patient at a time advances the humanism in healthcare. The smallest expression of the empathy make a huge lasting impressions. Some special moments that exemplifies the power of the empathy in healthcare. Suppose you pulled a muscle in your back while doing housework and you have been in a severe pain for the past 3 days. You need a hand to help sit or stand, and sleeping is almost impossible because you cannot find a position that does not cause your back to ache. You are in tears when you finally call the doctor's office to make an appointment. A nurse calls your name and checks your weight and height. He confirms your health history on the computer and takes your vitals. A nurse practitioner enters the room, asks about your activity level, hands you a prescription for the pain medication and walks out. Although the nursing team did everything right, you would probably leave the doctor's office feeling unsure. No one acknowledged your distress due to the pain. No one seemed to understand. No one showed you empathy. So, why clinical empathy is important in healthcare? Empathy is the main ingredient of the human compassionate care. The National Institute of the Health defines the empathy as the act of correctly acknowledging the emotional state of another without experiencing that state oneself. We feel the empathy when we try to understand the trial and tribulations of our children, the sad moments of our friends, and the stress of our spouse after a bad day at work, and the ills of our patient. Empathy is necessary for a healthcare provider to connect with the patient and at a times can be more effective in patient's care than technical ability. In fact, one of the strongest arguments for the empathy in healthcare setting is the strong correlation between having a good patient-doctor relationship and positive treatment outcome. If you are struggling with this necessary soft skill, know that it is not solely embedded in our DNA. It is a learned ability and you can inject more into your care by practicing and learning a few methods. Listen to your patient. Active listening means putting yourself in the other person's position as they described it. Think about what they must be feeling. Think about how you would feel if you were in their position, and when it is your turn to talk, repeat back what you think the other person's meant or how they might feel. While other people are talking, Most of us are thinking about what we are going to say. Test yourself. Next time you have a conversation with a friend, notice your thoughts. Are you thinking about how your friend must feel? Or are you preparing for your own response? You may be surprised how much people are willing to share when they think someone is really listening to them. Challenge your own prejudice and stereotypes. There will always be people in our lives who we are not comfortable around. Whether it is a coworker who you think does not like you or a friend's friend who always makes you feel awkward and underdressed, discomfort is inevitable, but it often stems from our own prejudice and assumption. Put yourself in other person's position. Since no one's life is perfect, what might their struggles be? What do they want? Find out their information by trying to get to know this person. Finding common ground is a great place to start. Make eye contact. Making eye contact can be very difficult. We may avoid eye contact in order to avoid confrontation, or it may be as simple as multitasking. Take a dive and look your patients in the eye. Pause between the questions if you are chatting or taking notes, and take time to make eye contact. According to a report quoted in the New York Times, children and adults who avoid or are denying to eye contact are more likely to suffer from the depression and feelings of isolation as well as exhibit antisocial traits such as callousness. In fact, according to the New York Times, patients of the doctors who made more eye contact had better health, adhered to more to medical advice, and were more likely to seek the treatment for the future problems. Non-verbal clues. Sometimes when someone says they are fine, their body language tells a very different story. The persons may be picking at their nails, avoiding eye contact, or slouching towards the door. All signs of someone who is not at all fine. Non-verbal cues are nearly impossible to fake, often paint a picture of what is really going, and are more accurate than the words. When used with awareness, non-verbal communication is a powerful way to build a rapport and strengthen the relationship. We teach the students to consider the mind, spirit, emotion, environment, and body when they treat the patient. Empathy, it is a great way to care for the whole person. In one example, patients of the doctors with a high empathy scores had a greater control over their disease. This goes to show that kind words and a little emotional support from a doctors can have a measurable impact on patient outcomes. As a busy doctor, you probably don't have a time to attend empathy training that gives you the tools you need to improve your patient relationship. So don't worry, if you follow all the 7 steps below, you will be on your way to mastering an empathetic approach to the patient care. So first of all, personal details are the key. So while the patient don't expect you to remember the name of their pet rabbit, you need to know more than how to say their names correctly. Take the time to jot down a few personal details during each visit and document life updates or significant events. Knowing these personal details about your patient will not only convince them you care, but will help cultivate feelings of the empathy. The more you know about someone, the more you will be able to understand where they are coming from. Second is spend an extra minute. Okay, this step might be a tough one for doctors operating against the clock, but try adding 1 minute to each visit. Spend that extra 60 seconds gathering the personal details and asking how the patients are doing generally, not just medically. patients will notice you taking the time and give you points for an empathetic approach. Third is make an eye contact. So the basic technique to building a positive doctor-patient relationship is getting harder and harder to follow. If you are using a computer or mobile device in the exam room, be sure you are not glued to the screen. Your non-verbal body language speaks just as loudly as your words, and refusing to make eye contact with the patient will damage any sense of the connection. If you are not sure how you are doing, take 5 minutes to role play an appointment with the staff members and ask them for feedback. Then show your support. If the patient is obviously upset or worried about something, acknowledge that they are going through a difficult situation. When delivering a new diagnosis, empathize that it is only natural for them to have questions and you would be happy to answer anything. If you are struggling to find the right words, check out these common responses. Fifth is put yourself in your patient's shoes. Most likely your patients have been waiting a while to see you. They probably had to take time off from a busy work schedule to come in. Maybe even find a babysitter to watch the kids. They might be worried about an uncertain medical condition, anxious about the potential bill, in pain from chronic condition. All these factors will make it harder for them to comprehend a new diagnosis, ask the right questions, or remember all the details of their treatment plan. If you are still struggling to empathize with your patients, try spending 5 minutes at the beginning of each week imagining your patient's perspective. Sixth is get patients' feedback on how you are doing. The best way to gauge your patient's perception of empathy, ask them. Design a patient satisfaction survey and include questions that target a positive doctor-patient relationship and physician empathy. Then share this article with your staff. Empathy training is important for your medical practice staff too. In many offices, patients likely spend more time interacting with combination of receptionists, medical assistants, and nurses than their doctors. That means a negative interaction with your staff that can influence the patient satisfaction just as much. So there you have its 7 simple strategies that will help you reframe patient interaction and leave the patients with the sense that you are truly care about them. Remember, it is only natural that limited time and job stress will affect your adherence to these empathy techniques. Stick to these steps and you will have happier and healthier patient. So if any questions regarding this video, please write down in comment section. Now if you like this video, then please subscribe my channel and press the bell icon. Thank you very much.